Reaching the limit, local hospitals battling overcrowded facilities and staffing shortages. This month, they've even been forced to divert ambulances to other healthcare facilities.
Officials at one hospital tell TV5's James Felton they're breaking capacity records month after month.
It feels like failure to us.
When an ambulance carrying a patient is turned away. Danny Gregg is the medical director of the emergency department at Mid-Michigan Health in Midland. He tells us since September, the hospital has been on diversion 4 times for a total of 10 hours. Gregg says a big reason for that is the number of patients.
We are breaking records every month. I mean, starting in May, we essentially have set a new volume record every month, and we're on target to set another new one this month.
Another factor is staff shortages.
There just aren't enough nurses. There's not enough ancillary staff. And what's happening in our area is if one of our big hospitals goes on diversion, that puts an extra strain on the next hospital, which leads them to go on diversion, and it's a domino effect.
Gregg tells us a combination of issues is contributing to the high patient count. COVID-19 is part of it, but only 37 of the 250 patients there are dealing with COVID. Gregg says there are other patients who have put off getting care during the pandemic who are sicker now. No matter the cause, the effect is a hospital nearly full of patients, with staff doing what they can to treat them.
It used to be that days like today, when you've got 45 patients on the board in a 24-bed ER, those happened every couple times a month. It was unusual, and you'd say, oh boy, what about that bad day we had? Now every day is a bad day, and it's wearing on people. The morale is not what it used to be, but I think we're holding up okay.
Gregg doesn't think this high patient count will continue. While they wait for the numbers to drop, efforts are being made to create more beds for those that need them. In the meantime, Gregg is asking all of us to do our part.
Try and have some patience with us. When you go to the ER, you might need to wait a little bit longer. We're keeping an eye on you. We're gonna meet your needs. We're gonna see you. You're gonna get good care.
Reporting in Midland, James Felton, WNEM TV5.
Also tonight, Hurley Medical Center in Flint is at 100% capacity.